Deb Deary. I'm one of the public health nurses here at the Kennedy Center and for the city of Quincy. And I'm here today to give our monthly class. We've decided this year, starting in 2023, once a month, we're going to talk about a different health topic with seniors. I give disclaimers at the beginning. I am a nurse. I'm an old nurse. I've been a nurse for 31 years now. I am not, however, since we're talking about eye care, I am not an optometrist and I'm not an ophthalmologist either. We're here to talk today about glaucoma. January is National Glaucoma Awareness for seniors. And so I thought it would be kind of cute to name this course, Here's Looking at You, Kid. Everyone remember that line?
Yeah.
Where did that line come from?
It comes from a Humphrey Bogart movie. With one called.
That's right, Casablanca. So it was very funny because when I named this course, some of my coworkers that might be a few years younger than me kind of said, I don't get it. And I had to explain the whole Humphrey Bogart, Here's Looking at You, Kid, at the beginning of it. So January is National Glaucoma Month. As we get older, things change. Lots of things change in our body. Our walking changes, our eating changes, our sleep patterns change. Today we're going to talk about the changes in our eye care and how our eyes actually change as well. Change is difficult, isn't it? Nobody likes to have to readjust a way that they've been doing something for many years because we kind of get into habits. We maybe have a hard time starting to see up close or see far away, and well, we'll just compensate for that instead of going and getting those tests done and those eye tests done that we should be doing. But changes in your vision are normal as you age. You may lose the ability to see up close. You may have a difficult time distinguishing, especially in colors. Blue and black look very similar at times. And adjustments to changing in light levels. So going from one environment into the other may be a difficult thing as you age. Most of these changes, though, are treated by glasses, contact lenses, eye drops, oral medications, or actual surgical treatments. Some examples of eye diseases that are relatively common as we age. These are conditions. Age-related macular degeneration. I wanted to just review a couple that maybe you might have heard when you're at the doctor, or you may have heard a friend of yours might have something similar to this. That is a condition that can affect the central vision to doing things like driving or actually focusing on reading. So the central part of your vision is affected with macular degeneration. Diabetic retinopathy. Diabetic retinopathy is when people who are diabetic start having a difficult time with their eyes, which is very, very common. It can occur if you're diabetic. It develops very slowly though, and not oftentimes with any warnings. You definitely need to make sure if you are diabetic that you are getting that yearly dilation of your pupils to make sure that your dilation level is at the level where it needs to be, along with keeping your blood sugar and your cholesterol at a good level. Cataracts. We hear about cataracts all the time. Cataracts, I remember when I was younger, you would hear about cataracts and it would be this major, major thing with someone who was a senior. Now they're so common and the surgical procedures that they have for them are so common that unfortunately it seems like a relatively easy type and common condition for seniors. It creates a cloudy area in your eye. I often say it's often easier to see that when even you might have a dog or a cat who has cataracts. You'll notice there's like a cloud lens that appears over the eye. and it causes blurred or hazy vision. Depending on the size, you may not have any change in your eyesight, but if the cataract's too large, it can definitely affect your vision and would need intervention. And then there's glaucoma, which is what we're going to go over. What is glaucoma? All of the information today that I'm giving you was taken from the Centers for Disease Control information, and they have a vision health initiative where they, not to put a pun on it, but they focus on the vision health for seniors. So any of the information that we're giving to you today is taken from the Centers of Disease Control Vision Health Initiative. And their definition is basically glaucoma is a very large definition for a group of different types of diseases. Glaucoma comes in different levels. There's sometimes an open-ended, a single-focused glaucoma. So it really depends on the individual. There's no one type for everybody. So it's a group of diseases that damage the eye's optic nerve and can result in vision loss and even blindness. So when it's diagnosed, the vision loss from glaucoma usually affects your peripheral vision. So your peripheral vision, if you're looking straight ahead, I can see that plaque on the wall because I'm looking at using my peripheral vision. I can see the cars out in the parking lot, that's my peripheral vision. When you're looking straight ahead, anything that you're seeing on the sides, this is what we're talking about. But it's a narrowing of this peripheral vision, what you can see on the side of your eye, and then later on, glaucoma will affect your central vision. So it's almost like a narrowing. Activities such as reading and driving then sometimes become severely affected with glaucoma. Anyone ever have any of those type symptoms or have any discussions with their physicians or eye doctors about glaucoma at all?
It runs in my family.
Does it?
Yeah,
Yep,
it does.
yep. So it's, you're on the list here. Facts about glaucoma. People with a family history of glaucoma. So you want to make sure that we're making sure we're going to those exams. About 3 million Americans actually have glaucoma. And it's the second leading cause of blindness worldwide, which is amazing to me. After I decided to talk about this month, and I started studying up on it a little bit more, I was amazed at, I didn't realize worldwide that it was so destructive, to be honest with you. Certain groups are at a higher risk. So the groups that we're going to talk about, African Americans over the age of 40 are at a higher risk. All people over the age of 60 are at higher risk. People with a family history, people who have diabetes, and unfortunately, one of the facts about glaucoma is right now there is no cure for glaucoma. So basically, glaucoma is taken care of by various forms of treatment. High-risk groups, if you're a high-risk group, get a comprehensive dilated eye exam. Do you get a dilated eye exam? Okay.
Once a year.
All right, very good, very good. So again, we're talking about people who are of African American descent, and anyone over the age of 60 who feels that they may have some issues concerning their eyes, their peripheral vision, or any concerns of that nature. As previously stated, currently there's no cure, but preventative measures. Also, if you're diabetic, glaucoma is really very, very prevalent with diabetic patients. Preventative measures. These are some of the preventative measures. So we want to make sure that we're watching our cholesterol, that we're watching our blood pressure. How many people here come to the blood pressure clinic here? One person? Well, we have blood pressure clinics. Karen, when do we have the clinic?
Wednesday and Thursday.
Wednesdays and Thursdays.
Wednesday, 11 to 12, and Thursday, 10 to 11.
Okay. So we have a clinic here and we take people's blood pressures. So if you at all want to schedule yourself just as a routine to come in and make sure your blood pressure is at a good level, Karen would be more than happy to take your blood pressure, or myself or Caitlin. Any of the nurses here would be happy to do that. But your blood pressure is crucial, your cholesterol is crucial. All of that factors in as well with a good diet, weight loss, and diabetes, watching your sugar intake. See that big thing in the middle there, that big no smoking. I'm hoping no one smokes anymore. My goodness, we have to get that washed out. But these are the preventative measures. So no smoking, good eating, watching your diet, making sure you're checking, having your cholesterol checked, doing a routine blood pressure check. Make sure you get enough exercise along with a balanced diet. Treatments for glaucoma and a lot of the other eye conditions that I was talking about, some of them are eye drops, oral medications, surgeries, lots of different types of laser treatments now. I've known of a lot of people with cataracts who kind of go in, do a laser treatment and come right out nowadays. So it's pretty fast nowadays in healthcare, a lot faster than we remember. Or a combination of any of the above. So eye drops, oral medications, surgery, laser treatments. These are the treatments that we'd be looking at to talk to our doctor about it. As you get older, you need to make sure you're seeing an eye doctor regularly. These are our takeaway facts. Our eyes will change with age. Change is inevitable. Everything changes in our body as we age, whether we like it or not. It's making sure that we're staying in touch with the clinicians and the people in our lives that need to monitor what our conditions are that are changing. Staying active and exercising, at least getting up and moving. Don't want you to get up and run the marathon every day, but you know what, when I see all you folks coming here to the senior center, to the Kennedy Center on a daily basis, it warms my heart, because no matter what age you are, you're getting up, you're getting out, and you're getting down here, and you're socializing with people, and also socializing with people, and also attending these courses and these informational sessions. Make sure we're stopping smoking. Anyone in your life that's stopping smoking, please, please, please encourage them to do so. Monitor your blood pressures. Come on down here to the Kennedy Center for that monitoring. And we have little cards, and we give you a little takeaway card so you can keep it in your bag or your wallet so you can monitor your blood pressure. And if you're diabetic, make sure you're monitoring your blood glucose. People who are diabetic, I very seldom give any advice to. They know their body, they know their blood sugars, they know how to manage it. We had a couple come in the other night, and he had a Libra blood glucose monitor on, and he actually schooled me, actually his wife did, on the changes and all of that. So he's been diabetic for quite some time, and he is dealing with issues with his eyesight as well. And it just started probably about a year and a half ago. So, you know, you could be diabetic all along and not be having had any changes in condition for your eyes, but as you get older, those conditions may very, very well change, especially if you are diabetic. And getting yearly eye exam, very important. Report any changes to your primary care doctor and or ophthalmologist. So if you're driving at night and all of a sudden you're starting to see a haze around the headlights that maybe you never saw before, or if on a regular day you are just looking at a newspaper and start seeing, people call them floaters, like the little black spots sometimes. Those are changes that people see sometimes. A blurriness in one eye over the other. Make sure you're talking to your doctor or you're getting an appointment with an ophthalmologist and letting them know about those changes. Preventative action is what we want to make sure that people are doing. This month being National Glaucoma Month, the CDC's main message is to folks to get out there and try to make sure that people are going to their physicians, going to their eye doctors, and trying to do preventative measures so that we're being proactive on any issues with glaucoma instead of having to be reactive on the other side. Because once it gets to a point, then we are talking about surgeries or treatments that may need to happen when the condition might have been able to be stopped at some point with some lesser type of a treatment. Okay? And I believe that's it for today.